In approaching the harm-free care programme, we were inspired by the Energise for Excellence framework, which we're already using within the organisation. And what we did, we issued a call to action to our ward leaders. We wanted the ward leaders to be involved to look at reducing harm within their areas and to act as change agents in reducing harm.
I was asked to join the harm-free cohort within the Trust, of which we were happy to do, and were asked to look at what was our most harm to our patients. And the one that obviously flagged up quite quickly was the number of falls that we had. When we were out in handover, and a patient had fallen over weekend and the staff were reporting to me on Monday morning. And I can remember, I knew that that patient had fell the week before. So I just said, "What, he's fell again?" And it was almost as though it was expected that because he had alcohol liver disease, he would fall. And that was my red light, because that should not happen.
When we started on the harm-free care work, we found it difficult to fit into the standard 4 harms. So after discussion with our improvement teams, we decided to look at how we specifically harmed our patients, which wasn't a comfortable concept to start off with. Examples of that would be muse escalation, medication, drug errors.
When the harm-free was rolled out and I joined, I was in a fortunate position that I was brand new to the Trust and the ward. So I came and approached it with a brand new pair of eyes, really. And the main challenges I saw immediately facing me were around just med safety.
We went to a professional development day and I was very enthused by what was being discussed and how patient care, by doing small step changes, can make a big difference in reducing harms. I undertook a PDSA cycle around hydration, especially as our patients have fasted for prolonged periods of time before theatre, and realised that making sure that patients received optimum hydration minimised the 4 harms. Therefore, we did a study where we changed patients' jugs of water every 6 hours, and we noticed that over a 24-hour period, some patients had a 750ml increase per day.
One of the specific changes we have made in relation to harm-free care and using that as a concept was improving medication administration and reducing interruptions. We did that by reallocating the roles of the staff on the ward. For example, we would have 1 nurse as coordinator conducting the morning ward rounds, 1 to 2 nurses looking after the acutely ill patients on the ward directly after handover. And then the final 2 nurses will be doing medication administration together, and the results were dramatic. It just really reduced the interruptions.
And then also made it quite clear to all the other health professionals who came on the ward that it was not acceptable to disturb the person doing the medicines. So there was 1 free nurse at all times to deal with any of the other problems, possibly admissions, discharges, or any of the questions that came out of ward rounds.
And I looked at my staffing establishment and that I was able to change the staffing mix and the number of staff to achieve 5 on night duty as opposed to 4, which meant that we were able to have a staff member in the bay with the patient every single hour, and we've also taken that on 2 days as well. I've also involved the ward physiotherapist because I wanted not just to have nurses be thinking about falls, I wanted the wider multidisciplinary team to be involved as well.
Yeah, our referee board is a board which displays our ward's development and performance, and especially around harms, complaints, compliments, and it's for patients, staff, visitors, anybody who visits the ward to see, and it gives us transparency, and anyone can come and actually see how we're doing.
The free work we do as well focuses a lot on local leadership, which was very good because we could take leadership back of our own areas and lead the improvement in our areas too.
The benefits are, because we're a little network now within the Trust, I can share my ideas and experiences with other ward managers and other teams, and also they can share their ideas with me, so it might be something that I've not thought of outside the box that I can trial on the ward that has a massive impact on patient experience and care. So
we've seen a significant reduction over the last 3 months, but we are aiming for no patients falling.
And it's about engaging with your staff as well and ensuring that staff are trained to an appropriate level so they can meet the care needs of the patient.
Partly because of its name, harm-free care work, it was easy to engage the staff in because no one comes to work to do harm.